Today, I'm very honored to introduce our guest, Dr. Heather Sandison. Dr. Sandison is the New York Times best-selling author of Reversing Alzheimer's, the new toolkit to improve cognition and protect brain health. She's a renowned naturopathic doctor specializing in neurocognitive medicine and the founder of Solcere Health Clinic, a premier brain optimization clinic based in San Diego, and Marama, a residential program changing memory care to memory recovery. Dr. Sandison is dedicated to supporting those suffering with dementia and is the primary author of peer-reviewed research published in the Journal of Alzheimer's Disease. She's shattering common misconceptions about Alzheimer's, teaching lifestyle change protocols that keep your brain sharp at any age. Dr. Sandison, really excited to have you on. Really appreciate you coming on for our listeners. Thank you.
Eddie, it's a privilege to be here having this conversation with
Yeah.
you.
Yeah, how are you?
Great. Thank
Great.
you so much for having me.
Yeah, absolutely. Absolutely. Well, we'll get started with kind of where a lot of people's minds start with this as we grapple with the past, the present, and where things may be going here for Alzheimer's treatment. Why did past treatment approaches to Alzheimer's fail for so long?
Yeah, when we think about the pharmaceutical approaches to this, there's a long story, and it's very well documented in a book by a gentleman named Carl Harroup. It's called How Not to Study a Disease, The Story of Alzheimer's. And, being the Alzheimer's nerd I am, I like read it on one plane ride and was so fired up because it made me mad, right? It's like the scientific method is supposed to be about proving not proving that something's right, but proving that something isn't right, right? Like there's a null hypothesis. And so you're constantly in this sort of skepticism, right? That as a good scientist, you're constantly saying, are the assumptions I'm making accurate? Are they true? Or is there something else that might explain this? And what we've seen over and over again is sort of the opposite of that, is that we've doubled down as a society, scientists, taxpayer dollars have gone into this amyloid plaque hypothesis. And that for good reason, is now being called into question. And there's a handful of things that have come up. One, amyloid as the cause of Alzheimer's it really narrows our part of it is there's so many directions to go in this, and it's very complex, but part of it is this desire to take this reductionistic approach and to simplify things, right? It's our human desire to find certainty, to make it simple, especially in the face of such a scary disease. We
Yeah.
want to find this single molecule intervention because that's what's incentivized in the pharmaceutical world, right?
Yeah.
If we can find a single molecule that we can then patent, that we can turn into a medication, that a doctor can prescribe in the 7-minute visit that they have, that you can go to the pharmacy and buy it, and the pharmaceutical company can get their return on the investment that they put into all of the drug trials. That's the model that we're set up for, right?
Yeah.
And unfortunately, even though we wanted to fit Alzheimer's into that box, it doesn't. It's a very complex disease with multiple reasons for why our brains degenerate.
Yeah.
And so, what we really need is an intervention that matches the complexity of that disease process.
Yeah.
And that is what Dr. Bredesen describes. It's what functional medicine describes. It's what Dr. David Perlmutter describes. I'm kind of on the high of coming off where it's Monday morning, and I just spent all weekend with them at the Thought Leaders Conference. And I just feel so inspired by the work that they're doing. Jeff Bland was there, and he is the godfather of functional
Yeah.
medicine. And we dove deep, and there were a lot of these reminders of like, hey, we were talking about this in the 80s. We were talking about this in the late 70s. And sure enough, as the science has progressed, what we see over and over again is that the explanation is complex. It's
Yeah.
complex system science. And when we apply that to our interventions, we see the best outcomes in the literature.
Yeah.
So, why has this not worked? Right now, we're talking about a lot of people are talking about the new blockbuster drugs for Alzheimer's. They are these antibody therapies that go after amyloid, that take the amyloid out of the brain. And there was a really scary New York Times article last week about just how dangerous these medications can be. Not
Yes.
only do you not get an improvement in cognition, which when I say the word Alzheimer's, this word really has been used for marketing purposes, and like for many, many years, because it puts the fear of God in you, right? Like you think of that person that you've met who's lost their dignity, their ability to go to the bathroom on their own, their ability to live independently, their ability to drive, their ability to put sentences together, to remember the names of their loved ones.
Yeah.
And that it's heartbreaking,
Yeah.
not just for that person, but for everyone around them who loves them.
Yeah.
And that's Alzheimer's, right? The beta, that person, their family, they don't care the number of amyloid, the amount of amyloid in their brain. What they
Yeah.
care about is their ability to live life.
That's right.
And that is measured in cognition,
Yeah.
right? That is measured, and there's blunt instruments for this, and there's very fine-tuned instruments for this. But when we look at these blockbuster amyloid antibody drugs, what we see is that they don't enhance cognition. You don't improve cognition. What
Yeah.
you do is you get rid of amyloid
Yeah.
and you get worse more slowly, maybe for
Maybe.
some people.
Yeah.
And the risk there is one, it's very costly, and two, there's a risk of brain bleeding and brain swelling.
Yeah.
And the risk is highest for people who are ApoE4 positive, who have the highest risk for developing dementia. They're
Sure.
the ones with the highest risk of being harmed by these medications.
Yeah.
And so a recent new analysis just last week, in late October of 2024, showed that there's a 3 to 4 fold risk of death after
Mhm.
these medications are used. And what we also see is that on imaging, the brains atrophy. They get smaller very quickly on these medications.
Yeah.
And Dr. George Perry, the chief editor at the Journal of Alzheimer's Disease, was quoted in the New York Times last week saying, we don't know
Yeah.
of uh, an indication that that is good for anyone, that a
Yeah.
shrinking brain is going to help anyone out, especially cognitively.
Yeah.
And so it really feels like depressing in some ways, but
Mhm.
also it's so laughable. It's so like just weird
Mhm.
that it's
Yeah.
like, okay, now there's this opening.
Yeah.
There's
Yeah.
this opportunity to be like, okay, what can fit into this huge
Yeah.
gap
Yeah.
that we need to fill
Mhm.
because so many people are suffering with dementia and Alzheimer's.
Yeah.
And when we apply complex system science approaches,
Yeah.
it's really common sense, just uncommon practice. When we apply that to brain health,
Yeah.
we see better outcomes.
Yeah, absolutely, absolutely. And yeah, no, you're so right, especially on the patient side, on the caregiver side. All we've heard for so many years is the word Alzheimer's and the other term amyloid almost be synonymous with one another. And you know, one of the biggest breakthroughs I had when I first read The End of Alzheimer's so many years back was Dr. Bredesen describing beta amyloid's heroic effects, its actual heroic um, purpose, or what we can perceive to be its purpose, because it seems like all these years it's been targeted as the arsonist, when in reality it's probably the firefighter that's showing up to help with whatever may actually be triggering the issues with the brain, and what Dr. Rudy Tanzi has shown. So that's can you get into that a little bit about how amyloid could potentially be uh, helping our brains or maybe defending our brains from other threats? Is that
Yeah,
right in that,
absolutely.
or yeah,
Yeah, yeah. And what we might want to do is put this into the context of it's almost like a switch flipping,
yeah,
right? So our bodies are either in degenerate mode or
yeah,
in regenerate mode.
yeah,
And we want to be in that healing regenerative mode where we're making synaptic connections.
yeah,
What we don't want to be doing is getting in that mode where we're shutting things down. We're in attack or defend mode. We want to be in that regenerative, like we're creating the way Dr. Bredesen, my mentor, talks about it. He's like, if you think of your brain as a country,
mhm,
if that country, my brainistan, is at war, if we are in attack and defend mode, that's where our resources are going.
yeah,
And there's a bunch of signaling happening from the top, right? Saying shut down or protect,
yeah,
defend, attack. And then if we can switch modes, then we can actually get into that synaptogenesis. We can start creating new connections. We can spend effort, time, energy, resources, recalling the name and thinking through complex issues. So when we think about amyloid, what's happening is that when we basically turn on amyloid, it is in that defend mode. Amyloid is antimicrobial.
mhm,
Tau proteins, phosphorylated tau is antimicrobial. So these things are basically launched in an effort to protect us. They're not there to give us Alzheimer's disease. They're there. Dr. Bredesen over the weekend, he had this really phenomenal analogy. So he's like, imagine your brain as a neighborhood of 10,000 homes.
Yeah.
If you have an invader come in, say a criminal, just one,
Yeah.
you don't want to pull out the SWAT teams and shut all the schools down.
Yeah.
You want to basically like just keep that invader like in their home, right? You want them on home arrest or whatever it's called. Now, if you have 500 come in, if you have a lot or 5,000, militants come in, then you want to shut everything down.
Yeah.
Amyloid is that home arrest, right? It's trying to just contain any of these little invaders and protect the 9,999 homes in our village, in our brain, right? So it's an appropriate response
Yeah.
to a relatively benign invader, right? So what we're trying to do is wall it off to
Hmm.
prevent it from infecting the rest of the brain.
Yeah.
And
Yeah.
now, we can also put things like blood sugar and dysregulated metabolism. What are they going to signal? So infections, right? Infections start to signal this attack defend. Toxins start to signal attack defend.
Yeah.
And that signaling is like we all have heard in the context of COVID about these cytokine storms.
Yeah.
So you can think of amyloid and p-tau almost as kind of cytokines in the brain,
Yeah.
right? They are this mess, they're these messengers that we're going in that attack defend mode.
Yeah. Yeah. Yeah, absolutely. That's such a great way to put it. And those metaphors, they really help because for so many years we've heard that amyloid's the issue, but in reality, it sounds like you're saying, it's much more complex, and there needs to be more testing and kind of a bigger flashlight applied to see, okay, why is the amyloid showing up in the first place?
So, like, I have a plant behind me right here. And if my plant were dying, I wouldn't go to my plant and be like, oh, there's misfolded proteins. We need to take out the misfolded proteins.
Yeah. Yeah.
I would think to myself, this is a complex organism.
Yeah.
Does it have enough water? Does it have enough light? Does it have enough nutrients?
Yeah.
Does it have toxicity?
Yeah.
Does it have too much of something?
Yeah.
And that's what we need to apply to the brain. So if we jump to blame amyloid or p-tau,
Yeah.
we miss the opportunity to ask, why is there amyloid?
Why?
Why is there p-tau?
Yeah.
Even inflammation, I'll hear some people say, oh, well, inflammation is the problem, or mitochondrial dysfunction is the problem.
Why?
But why?
Yeah.
Why?
Yeah. 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 That's so great. It's all about framing, and you and Dr. Bredesen and um all of you, the functional medicine, Dr. Jeff Bland, that framing is just so powerful. Um, Now, leading into that, the system science that you've applied, you specifically with this breakthrough study that you published back in August of 2023, you created some pretty amazing, compelling results there. So could you take us through a little bit of that and
Yeah, sure.
yeah, explain your results and how you got to those results?
Yeah, absolutely. So maybe I'll start like the science, just to put it into context. That was the second paper, and I basically confirmed what Dr. Bredesen had found in
Yeah.
our research. So in 2022, we were doing these concurrently. Dr. Dean Ornish was also doing this all in the time of COVID.
Yeah.
So we all started our research around 2019 or so, and we're recruiting for trials. So Dr. Bredesen's group, they had 25 participants in a 9-month intervention using Dr. Bredesen's protocol, which is what I used as well. And they took participants with MoCA scores down to 19. So they published in the Journal of Alzheimer's Disease as well in July of 2022, and they showed that 84% of their participants improved their cognitive function. And then a year later in 2023, in August, we published our results also in the Journal of Alzheimer's Disease. And we had 23 participants who we took through a 6-month intervention. So not quite as long, not the 9 months, but 6 months, we were looking for a quicker result because that's what I had seen clinically.
Yeah.
And we took participants who had MoCA scores between 12 and 23. So the MoCA score is the Montreal Cognitive Assessment.
Yeah.
And this is a blunt instrument. It's a way to put a number on where someone is in the spectrum of cognitive decline. And Dr. Bredesen's group took participants with MoCA scores down to 19. 26 and above is normal. Once you start getting below 24, this is starting to affect people. They're noticing, or their loved ones are noticing. And down to 19, this is definitely mild cognitive impairment in that zone.
Yeah.
And we were taking patients, we did not exclude people who had a diagnosis of Alzheimer's. We included people with much more progressed disease down to 12, and then we didn't take anyone with normal cognition on a MoCA. So they had to have below a 23 or 23 or below. And what we saw, as you might expect, is that 74% of our patients improved.
Yeah.
So it wasn't the 84% for with a longer intervention, less cognitive impairment. 84% of the time. So this is consistent with what we see clinically. The earlier we get involved, the earlier we can start this approach, the
Yeah.
younger someone is, the better and quicker the outcomes.
Oh, yeah.
And the more confidence we have, the later stages, it's harder. It takes more effort. It takes more time. We know that dementia, the changes in the brain start decades before those early symptoms. And so there are these 4 stages that Dr. Bredesen describes. The first is that pre-symptomatic phase where the changes that our brain is in that attack and defend mode. We're already starting to accumulate potentially amyloid or tau or there's neurodegeneration happening, but we're not aware of it. We cope with it.
Yeah.
And then the second stage is the subjective cognitive impairment, where we're aware, but it might not get measured on these instruments. It might not be measurable yet. The third stage is measurable cognitive impairment or mild cognitive impairment. And there's nothing mild about this stage, right? People are losing their jobs. They're not able to drive anymore. They are not able to feed themselves sometimes or cook or do complex tasks. But they might still be able to get dressed and do some things independently throughout the day, but not at the level that they used to be.
Yeah.
And then the fourth stage is actually a very late stage. This is diagnosed Alzheimer's, where people really are losing their dignity, their ability to live independently. And if we can intervene earlier on, if we can prevent, delay, we have so much more confidence.
Yeah.
So, but we also see that people, even at very late stages, they've surprised me and taught
Yeah.
me that it is possible to see improvement.
Yeah. Yeah.
So hopefully that's helpful. But
Yeah,
and
no,
then
that's
also
great.
the study. So
Yeah.
just in 2024,
Yeah.
there have been, in June of 2024, we saw Dr. Dean Ornish's
Yeah.
paper was published,
Yeah.
and it was the first randomized controlled trial
Yeah.
that showed the difference in a lifestyle intervention for compared to control. There were 49 people in their study, and they showed a statistically significant improvement in cognition for people with early Alzheimer's disease and mild cognitive impairment. So now there's a controlled trial, and they did that in just 5 months.
Yeah. Yeah.
So even quicker.
It's amazing. It's amazing.
Yeah,
Yeah, no,
really
this
fun.
this approach that you guys have been implementing, um, it the research papers that keep coming out just shows that this really, as you guys iterate and you optimize it, it is becoming really what the standard's going to be going
I
forward.
hope so.
Yeah, absolutely. I hope so too. But I've got a lot of confidence and faith in you guys. You're doing great work. Um, you have these pillars that you use, these very systemized central pillars to how you help patients recover memory, recover cognitive function, increase those MoCA scores. Can you kind of go into those pillars?
Yeah, so at Marama, I often speak about these pillars, and this is the lifestyle. This is, I think of the lifestyle piece is the bulk of this. Everything else is icing on the cake, right? Like, but the cake itself,
Yeah.
and keto cake, of course, is these lifestyle pillars. We can, if we pull these levers, and I don't even recommend getting any expensive testing done until you are pulling these levers. Don't worry about all of I mean, it's so painful to say that. I don't mean don't worry about it. If you can't, if you
Yeah.
feel financially constrained, focus on these 4 things. So the 4 pillars I think of are diet, an
Yeah.
organic ketogenic diet. If you do nothing else, do that. Get into ketosis, get that metabolic flexibility. Nobody needs to be in ketosis forever, but a
Mhm.
sustained keto diet for 3 to 6 months for anyone suffering with cognitive impairment. There's a healing process that takes place.
Yeah.
And just getting the carbohydrates, especially the highly processed carbohydrates, out of the diet
Yeah.
That is a detox process, but getting metabolically into ketosis, it's detoxifying, it supports mitochondrial function, it supports the generation of enough resource, of enough energy for the brain. It also is so it's detoxifying, it's less creates less oxidative stress. One of the hallmarks of aging, we reduce that oxidative stress when we're in ketosis rather than glycolysis. There's a huge number of benefits for getting into the ketogenic diet, into metabolic ketosis. And
Yeah.
then over time, what we want to do is go back and forth. Life happens, go to Italy, eat the pasta, like whatever. But when you come back, get back into ketosis.
Yeah.
And then when you come out of ketosis, I highly recommend Mediterranean diet or a paleo diet or even maybe a plant-based diet.
Yeah.
So always organic and always minimizing as much as you possibly can processed foods.
Yeah.
So that is pillar one, is diet.
Yeah.
The second pillar that we talk about at Marama is activities. And this is like, what do we do when we're not eating during the day, right?
Yeah.
It's the exercise. So it's physical activity, but it's also cognitive activity, cognitive engagement. It's social engagement. It's purpose. It's meaning. It's like, what are we spending our days doing?
Yeah.
And this is an invitation to be like, okay, if my priority is my brain health or my loved one's brain health, how do we spend our day? Do we spend it sitting in front of the TV? Do we spend it vegging out, not really doing much? Or are we engaged in music and in maybe playing cards or dancing or getting going for a walk? Are we meeting up with our friends? Are we putting effort into the things that are going to support our brain health? Are we having fun? Are we finding joy?
Yeah.
Because if there's no reason to live, or to like, if we don't have any motivation and nothing to live for, it's going
Yeah.
to be hard
Yeah.
to engage in these things. It's going to be hard. Why do we need to remember if we're not having a good time?
Yeah. Absolutely.
So those activities, building them, investing the time in them, investing the effort in them, and understanding, for this particular person, like for one person, it's going to be pickleball, which is amazing, right? Hand-eye coordination, social engagement. Often people are outside, you're getting the physical exercise, there's strategy involved. Racket sports are amazing. Ballroom dancing, amazing for brain health. Um, but that's not for everyone,
Yeah.
right? And so what is it for and what are the interests? And there's a wide spectrum, and this is very individualized. But
Mhm.
how can I think of channeling my inner Betty White. How can we imagine a life that just
Yeah.
gets better and better and better as we age?
Yeah.
And this comes out of Becca Levy's work. She's at Yale. She wrote a book called Breaking the Age Code. And it's about, essentially, she published the research that shows that optimists lived about 7.5 years longer.
Yeah.
And also that if we have these ApoE4 genetics, that we can actually eliminate the risk associated if we imagine that there's lots to live for, that life is just
Yeah.
going to get better.
Yeah.
And this ties into another pillar at Marama. The third pillar is it is that it's the relationship with caregivers.
Yeah.
It's that expectation from the people we interact with that we are going to get better. That changes the dynamics in so many ways that are so subtle, but so profoundly impactful,
Yeah.
right? So you can imagine if you twist your ankle, say you sprain your ankle or tear an ACL or something happens, you end up in PT. And Eddie ends up in PT and he's in his 30s or 40s, right?
Yeah.
And or your dad ends up in PT and he's in his 80s.
Mm-hmm.
The difference in care you're going to get because of the expectation associated with your age.
Sure.
And what we want to do is get a PT who's going to treat your 80-year-old dad just like you, who's
Yeah.
going to say, no, work a little bit harder. I'm going to give you these exercises because I'm expecting you to be able to go for a run. And
Yeah.
I'm expecting you to be able to go back to playing basketball the way you used to and want to, and that you get so much delight from.
Yeah.
That's the kind of engagement versus the PT, the physical therapist, who's going to be like, oh, don't worry about it. Like, we're not
Yeah.
expecting you to build that muscle back ever.
Yeah.
So I'm not going to push you that hard, or I'm not going to give
Mhm.
you these exercises that are going to prepare you for that.
Yeah.
And the same thing happens at Marama, when we have caregivers, and because we've been in the senior living space now for 5-6 years,
Yeah.
we've seen that a lot of people who are trained in that, they feel like their job is to do it for you, is to
Mhm.
feed someone who's struggling to feed themselves, or to write something down for someone who's struggling to write something, or to go find that book or that thing, that magazine or find the color for them if they're doing something. And what we recommend they do is gently, kindly encourage
Yeah.
our residents to do it for themselves, to
Yeah.
maintain that independence.
Yeah.
And if it takes a little longer, do it anyways.
Yeah.
Have the time, have the patience, cultivate that patience so that we can help and support our residents in maintaining as much independence as possible.
Yeah.
So
Yeah.
that's three pillars. It's diet, it's exercises and activities, engagement. It's the type of care.
Yeah.
And then the fourth is the environment. And
Yeah.
our environment plays a huge role in our behavior.
Yeah.
So there's Atomic Habits, like
Yeah.
one of the most popular books on the planet. James Clear talks through how we can set our environment up so that we do the things, like if we have a list of all these brain engaging activities and we have a list of these brain health priorities,
Yeah.
but then we make it harder to do that. And it's easy to just turn the TV on, or it's easy to eat the donuts that are on the countertop, right? Then it's going to take way more effort to
Yeah.
not eat the donut and to not turn the TV on. But if we put the TV in the cabinet and we lock it away
Yeah.
and we hide the remote from ourselves, now all of a sudden it's harder to turn the TV on and veg out. If we
Mhm.
don't buy donuts, if we don't come home with them, they're not sitting on the counter. If instead there's fat bombs that are at eye level in the refrigerator,
Yeah.
all of a sudden it's easier to engage in the activities and the food, the diet, the things that are aligned with our priorities and our goals.
Yeah.
And so how do we design an environment that does that? So that's one part of environment. The other part of environment is just a non-toxic environment.
Yeah.
Indoor air quality is terrible.
Hmm.
Um, Things are off-gassing, it gets concentrated. So opening doors and windows, having air filters, keeping down the toxicity of what we inhale
Hmm.
is important, very important, because there is inhalant Alzheimer's. We
Yep.
see that
Yep.
cigarette smoke and air pollution contribute to Alzheimer's risk.
Yeah.
And I think that it's a little bit underrepresented outside of the functional medicine space. This is mold toxicity
Yep.
directly can lead to cognitive decline, mercury, lead. This is well documented. And so being aware of that, testing for it, eliminating it
Yeah.
as much as we can, wherever we can, is important.
Yeah. Great. Great. Yeah. No, this such great pillars. And, what I'm hearing from you is so much of this when you're looking at like a situation like ours, where, you know, we're caregivers, we're doing this at home, and trying to set up an environment like what we did was, we all got under one roof and we decided, hey, we're going to create a recode center, right? And we're all going to follow the protocol. But what you're really highlighting is it starts with that psychological, it's that mindset shift. And when you're talking about that expectation, it flies in the face of what we've heard for so many years because most of neurology or most of what caregivers and patients have heard is basically diagnose and adios.
Right.
To get your affairs in order, and there is dignity in that, but there is this mindset shift of expecting. It kind of reminds me a little bit of Viktor Frankl's A Man's Search for Meaning. We do need to visualize, what we'd like it to be, and that kind of starts everything off because if not, we don't put the effort in. So it is really powerful. And what's amazing is that you're doing it in this not memory care, but a memory recovery center. And I got to ask you about that. I mean, where did that come from? This is first in class, really, that I know of. Where this idea or where did this desire, this motivation to create Marama come from?
Really, everything that we've done is because someone asked. It's because a family like yours came to us and said, "Hey, they didn't have the ability to keep their loved one at home." She was a woman who I can relate to. She was, her dad was aging. He'd been diagnosed with Alzheimer's. She had read Dr. Bredesen's book, listened to it during her commute to work. But she's working full time. She's got teenagers so that she wants to show up at their sports games, and a husband that she wants to maintain a relationship, and a house to manage.
Yeah,
And all of that is too much already.
yeah,
And so the thought of taking this on to care for her dad, to cook for him and create these activities and to engage him and have him move into her house she's like, as much as I love that fantasy, it's just not reality for
Yeah.
me. And so where can I send him?
Yeah.
And I got that email. It was really just this kind of crazy day. It was my first day back from maternity leave. I got this email from a woman. Um, and during my lunch break, I was like, okay, where can I send them? Where can I refer them to? So I started Googling, who's doing Bredesen protocol in a senior living setting. There were a couple places that kind of referred to it, but you
Yeah.
could tell they weren't doing an organic ketogenic diet. They kind of said like, oh, we'll drive you to your Bredesen trained provider.
Uh,
And we have a gym and we have the things, but they were on their own. You could tell. And you could also tell they were going to sit down at dinner and have somebody eating cake and cookies right next to them, right? Which is really hard when you have cognitive impairment to remember that you can't, that's not on your diet, or an apple or a banana, right? Isn't this healthy for me?
yeah.
We have those conversations all the time, but when you can create an environment that's fully immersive, where the default is an organic ketogenic diet, the default is that everybody's going to get up and do yoga or, engage in meditation or whatever's on the agenda, and that everyone's kind of excited about it, and that there's enough staff to get people engaged and excited about it. That's really crucial. It's right that it's easy for us to say, oh no, I'm tired today. I'm going to crawl back in bed. I don't really
Yeah.
want to put in the effort.
Yeah.
It's hard. It's hard and it takes effort.
Yeah.
And so having enough people there to keep everyone engaged is a really crucial part of it. And of course, Eddie, it was like this day that I had this idea and realized there was this gap. I was like, well, how hard could it be? And then I realized now, 5 years later,
Yeah.
I'm like, oh, it's really hard.
Yeah.
But it's also so amazing. We had a woman move into Marama here in San Diego last May, and she moved in with a MoCA score of 24. She was nervous. She noticed her cognitive decline, and for her birthday, she moved in on her birthday as a gift to herself while her house was being remediated with mold. She moved in for 6 months, and
Yeah.
she moved home with a MoCA score of 30. And
Uh,
that it was
that's
just
amazing.
like, yes,
That's
like
amazing. Yeah.
that's the point.
Yeah.
That's the point. Is like to instead of her going in the direction of needing memory care, being
Yeah.
institutionalized, she went in the opposite direction. She got back control of her brain health, got
Yeah.
it back to optimal. It's a work in progress, right? She's got to stay on it. We see that. We had a woman who moved in to San Diego and she moved in with a MoCA score. I think it was 9-ish, maybe 9, 10,
Yeah.
and moved home with it at like 22. And her
Wow.
family wanted her to be closer to them, wanted her to be, living under their roof and enjoying that time, of course, makes perfect sense.
Yeah.
And then unfortunately, when she went home, she fell off the diet and her son was traveling, I think, more than he expected. And she was pretty isolated.
Yeah.
And so they decided, because Kansas at that point, our Marama, Kansas was open. So she moved back into Marama, Kansas
Yeah.
with her MoCA score around the same, I think it was maybe a 12. And
Yeah.
now 10 months later, she's back up at the 22, 23 because she's
Amazing.
engaged. She's eating
Wow.
the diet. And so it's one of those things, if you fall off the program,
Yeah.
you see that the cognitive impairment comes back.
Yeah.
The disease, it's not a cure, right?
Yeah.
The disease doesn't fully, it's not like you take an antibiotic and this goes away forever.
Yeah.
That is not what's going on. We have to work at keeping our brains in that regenerate, heal state.
Yeah.
And what's really exciting, Dr. Redison published this year, there are people who've been on the program for 10 years and have
Yeah.
maintained their cognitive function.
Yes. Yes. Yeah. No, it's exciting. It's exciting. Yeah. That original 2014 cohort. It's amazing. It's been over 10 years now and sustained improvement, the imaging, you'd think it'd be on the front page of every newspaper. It's just tremendously amazing. But yeah, what you guys are doing with Marama is amazing and hope it is the standard for really what memory care, memory recovery can be very shortly in short order. You know, you're talking about creating this environment and how much effort it takes to really systemize everything and make it easy. And I think about our environment. I think about our default environment that we kind of currently have right now, at least here in the US. Um, what would you say are the main environmental and lifestyle factors that recently have been contributing to the higher rates of Alzheimer's disease and cognitive decline?
Yeah, I worry a lot about the toxins and pollutants in our environment, the plastics and the endocrine disruption, the things throwing off our immune system, the toxins that make us more susceptible to infections, the stress, right? There's so many pieces to this. And I think that if you hear me hesitating, it's because I don't want to go down this super negative path. There's
Yeah.
so much hope here. We're in this, that Dr. Bredesen was saying this weekend, like we're in this golden age.
Yeah.
Like we're figuring some things out, some really hard things, like we're seeing better results. And so what I don't want to do is scare everyone, but
Yeah.
like I don't have plastic in my kitchen.
Yeah.
I don't drink out of plastic water bottles. Well, if you catch me in an airport and I have one, like there are exceptions occasionally when I don't want to be dehydrated. But for the most part, right, for what our default is to stay away from any conventional foods, any processed foods, because what's easy is the highly processed foods in our environment,
Yeah.
in the stores, at the restaurants. And those, when you go to a restaurant, unless it's probably a super high-end restaurant and you know the owner, they're probably using the cheapest oils they can get because they've got to make their margin. They have to stay in business, and that's a hard business.
Yeah. Yeah.
And I get it, like, right, in grocery stores too. They make their margins on what's in the center of the highly processed, highly profitable foods
Yeah.
that are highly palatable, right? Our brains are programmed to want more sugar, want more carbohydrates,
Yeah.
and those salt, fat, sugar. And when we kind of fall into that trap, it puts us in that attack and defend mode.
Yeah. Yeah.
We end up with insulin resistance. We turn on the wrong pathways when it comes to our immune cells. And we end up with these cytokine storms. We end up eating, when we're eating the wrong thing. I think diet, if you took one thing away, so sleep and diet, or
Yes.
we could talk about sleep. I feel like sleep would
Yes.
add to this conversation, and then I wouldn't have to like scare everyone into thinking they're eating horrible food.
No, I totally get it. I totally get it. Look, so I talk about the scare factor. We just had an interview with Dr. Stephanie Seneff on glyphosate. So I totally get it, and it's something that we definitely all have to be cognizant of. But absolutely, it's something that we are all better for eating real food over processed, manufactured food-like substances that have become the majority of so many Americans' calories. But
I'm
yes,
so glad you got to talk to her. She's such a wealth of information, just somebody I
yeah,
have so much respect for. And she's really gone out there and shared the science of
yeah,
why glyphosate is so scary.
yeah.
And we see that, ALS in particular, in terms of neurodegenerative diseases, ALS is when every ALS patient I've seen has very, very high levels of
Yeah,
glyphosate. And
yeah.
it is directly neurotoxic. And so
It,
avoiding any of the foods that end up being genetically modified and having a lot of glyphosate sprayed on them, avoiding spraying it in your
yes,
yard, and
yes.
get that stuff out of your house. Do not use it. I don't care about the weeds. I care about your brain.
Yeah,
Um,
yeah. Oh yeah, yeah,
so good.
yeah,
I'm glad you're having those conversations. But sleep. So in terms of toxins, like just putting sleep into the toxin concept into that context, sleep is so crucially important
yeah,
because that is when our brain rinses. That glymphatic rinsing happens during deep sleep. And if we
yeah.
skip that, we just one night of sleep deprivation leads to measurable amyloid in the brain of people in their 20s and 30s. So
Yes,
it's really important that no matter what age we're at, we are getting adequate sleep and good high quality sleep. So what does that mean? At least 7 hours of sleep. So, and ideally it's uninterrupted,
yeah,
and then at least an hour of deep sleep and at least 90 minutes of REM sleep. And that is, most people will feel rested. So the most important question to ask yourself around sleep is, do I wake rested?
yeah,
If the answer is no, I beg of you, go see somebody who you can talk to about optimizing your sleep, because sleep is crucial for brain health as we age. Absolutely crucial. And sleep apnea, I think that we could reduce the suffering associated with dementia if
yeah,
we got aggressive about screening anyone with cognitive decline for sleep apnea, and
yeah,
then got aggressive about treating it, even if it's just mild. Mild sleep apnea, you can actually treat with mouth tape.
yeah,
So just using a little bit of mouth tape, making sure that you are breathing through your nose.
yeah,
The the There's so much to this, right? The structure of the jaw, the structure of
yeah,
the sinuses. Um, a lot of that, because of our diets as children, it doesn't form as optimally as it could for breathing through the nose.
yeah,
But having your kids chew on things that are hard, not just soft foods, that helps the palate form so that the sinuses stay patent, so they stay open, you can breathe through them. And then really encouraging kids, adults, anybody, breathe through your nose,
Yeah.
no mouth breathing.
Yeah. Yeah.
It'll open up the sinuses so that you can breathe through your nose at night. That's how you get enough air into your lungs and
Yeah.
oxygen to your brain at night. If you
Yeah.
are having apnea events or mouth breathing, you're not getting enough blood to your brain,
Yeah.
enough oxygen to your brain, and that creates hypoxia. It's essentially mild brain damage every night.
Yeah. Yeah. Wow. Yeah. What I'm hearing is it sounds like, it's a multimodal treatment program, and there are a lot of things that help, but really, it sounds like from your experience with patients, some of the biggest pillars there, some of the biggest core areas, if you can really dial in the diet and you can really dial in sleep quality, you can make a massive shift in the right direction. Um, so, diet, sleep. Now, going back to toxins, and another big breakthrough for me reading Dr. Bredesen for the first time was these subtypes,
Mhm.
the inflammatory, the atrophic, the toxic. My dad was diagnosed with early onset Alzheimer's, and we know quite a few who've also been diagnosed with the early onset. And it seems like early onset uh, tends to fall more into that toxic subtype. So I know you listed a few, but just so that listeners can kind of have a good idea on what they should have on their radar when they do get to that testing phase, what are some of the most common toxins that light up testing from your experience when people start presenting with that subtype symptoms?
Yeah, and I would say just kind of going back to that subtype conversation. So the way I think of it is like, okay, if there's this destination that is a diagnosis of Alzheimer's or age-related memory loss,
Yeah,
there are multiple pathways that you can take to get there, right? And that's part of what I want to understand. It's like if beta amyloid, let's say that's elevated, if that question is why, if that's the most important question, then the answer comes in these subtypes. Okay, so this is the why. It's because there was toxic exposure, because there was traumatic brain injuries, because there's glycotoxicity, there's too much blood sugar and insulin resistance and all of that. There's
yeah,
infections. But the crucial thing here is that they're not mutually exclusive. You can
mhm,
have them all, or you
yeah,
can have this subset or that subset. And so you're talking about type 3, which is the toxic type. And I think of toxins in three flavors. Now, these are the ones that we can measure. There's a
yeah,
whole bunch we can't.
yeah,
But I assume anybody 65 and older has accumulated toxins because unfortunately we live in a toxic world. And so what can we do about that? How can we make that empowering rather than depressing? We open our what we call naturopathic doctors called the emunctories. This is our fancy word for the organs of elimination. This is our liver, our lungs, our bowels, our kidneys, and our skin and lymph. And so we want to sweat. Sauna therapy is associated with lower rates of dementia and better mood. We want to make sure that we're getting good, clean, filtered water and we're flushing our kidneys. Now, not too much, not too little.
yeah,
And then we want to make sure we're having a bowel movement every day and have enough fiber that we are getting things out. We are eliminating. We want to make sure we have enough of the nutrients that are necessary for our liver to go through phase 1 and phase 2 detox so that we can spit that toxic sludge out in the bile and it can go into the bowels and be eliminated.
yeah,
And then we can bring it downstream from our cells and from our bloodstream into the liver to be processed so that if we don't have that bowel movement, we run the risk of having it go back to the liver. And now the liver is taking out yesterday's trash in addition to today's trash. And then if the liver doesn't have enough nutrients, it's not going to take out any trash. And now we're just accumulating and building up more and more and more. We're in more of that attack and defend mode,
yeah,
right?
yeah,
And so we want to make sure that all of our organs are supported. Lungs are one that gets, I think, neglected.
yeah,
But the lungs, this is why a breathalyzer works for cops, right? We exhale acetaldehyde, one of the metabolites of alcohol. We want to exhale. This helps with our acid-base balance. It also helps with heart rate variability and our bringing our heart rate down. It helps with anxiety, depression. but being really conscious of our breath,
Yeah.
it's something that we have so much control over that I think we underutilize. And it's a great way to detoxify. And there's lots of, you can search YouTube for detox breath work, and there's lots of people who will take you through it. So there's lots of ways to upregulate this detox process naturally and gently. We want to make sure we're eliminating. The ways we eliminate is we pee, we poop, we sweat, and we exhale.
Yeah.
So making sure that we're doing that. And then with the toxins, the flavors that we think about, and again, this is like icing on the cake. So those lifestyle pieces,
Yeah.
just getting into a ketogenic diet and getting good sleep, like those things are so foundational, and they work for anybody, regardless of what you might find on these tests.
Yeah.
And there have been patients where I've test their mercury, their heavy metals, and it's off the charts. And it's like, oh my gosh, this is the smoking gun. This is the thing that is driving neurodegeneration, or one of the things. So if we have the luxury, we want to look.
Yeah.
So heavy metals are one, and mercury, arsenic, cadmium, lead, those are kind of the most common.
Yeah.
Number two is mold toxicity or biotoxins. This
Yeah.
comes from exposure to a water damaged building. And these are things like ochratoxins, aflatoxins, gliotoxin, trichothecene, zearalenone. These are elevated after you've been exposed to mold. So it's not the mold itself, it's not alive, it's not reproducing, it's not the mold itself, it's what the mold makes that is highly toxic. There's medication, Celcept is the name of medication that is used for immunosuppression that is
Yeah.
essentially encapsulated mycotoxin, right? So we
Wow.
know the pharmaceutical industry has embraced this, right? Like
Yeah.
to reduce immune function in the case of autoimmune disease. But what we don't want to do is be inadvertently exposed to that, have it suppressing our immune function. And many of these are directly neurotoxic. So we want to get rid of those. And we want to identify them. And 75% of environmental illness, the medicine is eliminating the exposure, right? Just stop putting it into the system. And then
Yeah.
the other 25% is how do we get it out?
Yeah.
So often when we do the detective work of looking at the labs, we don't realize that we're being exposed to something. And then we can figure out, okay, where is it coming from? And how do we just stop putting it in the system? So the third category is chemical toxicity.
Okay.
And that is our parabens, phthalates, PCBs. It's our, the BPA. It's all the endocrine disruptors. It's the petrochemicals.
Yeah.
It's all that junk that comes from the environment. And a lot of it we don't have control over.
Yeah. Yeah.
And so what we want to do, that's again, we go back to the emunctories. Let's
Yeah.
just keep it moving. Let's keep it moving through us, get it out so it's not accumulating in the brain.
Yeah. 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 No, that's great. I mean, yeah, it's sometimes it can be overwhelming if we think about all these chemicals, but what's great is that going back to this foundation of dialing the diet, dialing the sleep, those have so many great benefits, but for the brain, but they're also directly helping all these the emunctories, right? The detoxification pathways that will help us keep things moving. And if we are exposed and we don't know, or um, it's going to help us clear these things that much better. So that's great. You know, this book that you wrote, I don't know if it's going to come out fuzzy here. This is such a great book. I love this book. It's right up there with The End of Alzheimer's, and it's got such a bold title. I love it. And you've delivered, you're delivering. Can you tell us a little bit about this book for our listeners and why you wrote it?
Yeah, sure. I've never thought of it as my book. It very much belongs. It's Dr. Bredesen's work.
Yeah,
And then it's the stories that I've had the privilege of witnessing, right? It's the
yeah,
people who I get to work with, like you and your dad and your family. It's like, it's just such a privilege. It's so amazing that like I get this window and to learn from, I was telling you, like these incredible people who show up in my office. And I'm like, I just do the easy part. I just like basically translate what Dr. Bredesen said. But I feel like I'm a pragmatist, right? So if nothing else, I'm like, okay, how do we take what can feel overwhelming and complicated and just make it doable?
yeah,
And again, like everything that we've done has been in response to people asking. And part of what happened was we were doing the summits and created Marama. And then we had people calling and saying, well, I love the idea of Marama, but we can't afford it. And I live in Massachusetts. I don't want to send my mom to San Diego. I want her here with me. And so how do I create this at home?
Yeah.
And so we created a coaching program called Marama at Home
Yeah.
with the idea of doing that, just that. Like, let's get people the resources, the information so that they can do this at home. And then that is what turned into the book, because even the coaching program, it's like, like a lot of people had it online. And I know if I buy a course, like I never go back and listen to all of it and I don't get all of it. And the book felt more tangible. It was like,
Yeah.
okay, for $30, we can get people something that really packs in a ton of actionable information
Yeah.
that's based on the science.
Yeah.
And through the lens of the stories of people who have done it, who've done well with it, and they're despite their challenges and their constraints, people have been able to apply it. And each of these pieces is kind of broken down. So the diet and the exercise and the
Yeah.
sleep and partnering with a provider and getting the activities, all of that is broken down in ways that we hope make it accessible and personal so that it feels compelling and relatively easy to do.
Yeah. Yeah.
And that's
Yeah. No, it's such a great resource. It's an awesome tool. And it was a much needed follow-up to Bredesen's books are great. But you're exactly right. And I speak to a lot of people who are in a similar position to us. And um, the most important thing is getting a team around the person. And there needs to be at least somebody on the team who's willing to dive into a resource like your book and these other books to start building that environment and building those systems around your loved one. And your book spells things out in such a great, simplified way that's very easy to digest and very easy to implement. So, uh, helpful for us. It'll be linked on the description below, but it's such a great book.
And
Um,
if there's an opportunity, just real quick, to double
yeah,
click on another piece that I think is important in
yeah,
the book, and that's caring for the caregiver.
yeah,
Is
yeah,
caring for someone with dementia is not a one-person job. I know you can speak to that
yeah,
probably even more than I can. And it's one of the first things I tell someone who comes in who's caring for a spouse or a parent. It's like, you cannot do this alone. It's not fair to you. It's not fair to them. And you need a life, you need an identity outside of being the caregiver. I know that you're the best one to do it and that you'll feel guilty when you go do something else and they'll tell you maybe not to leave. And you must figure out a way to do it, because
yeah,
I've seen too many families in that desperate situation where someone, the caregiver, the primary caregiver, falls and breaks their hip and they're in the hospital and they can't care for the person with Alzheimer's.
yeah,
And so having that backstop, having that other person that knows your loved one, who knows their preferences, who knows their schedule, who
yeah,
can come in and fill in when you're desperate for it, that is way better than just getting a warm body who's essentially a babysitter who your
yeah,
loved one with Alzheimer's doesn't know.
yeah,
And so do that earlier for many reasons. One, because I don't want you in that desperate situation. Two,
yeah,
because it's not a one person job. You're not allowed to do it on your own. It was
yeah,
too depleting.
yeah,
You need time for yourself. You need an identity of your own.
yeah,
And you will be a better caregiver
yeah,
if you get that time to yourself. So 8 hours once a week to yourself, where you get exercise, you engage in your hobbies, you do not talk about dementia, you do not take care of your grandkids, you
yeah,
take care of you.
yeah,
So, so important to the sustainability, because I
yeah,
have a 5-year-old. She's
yeah,
getting older, she's getting more independent, she's on track. The caregiving is getting less. With dementia,
yeah,
you don't know if it's going to last 3 years or 5 years or 8 months or 15 years.
yeah,
It is so unpredictable,
yeah,
and it is emotionally draining, physically draining, financially draining.
yeah,
You need help. Get help.
yeah. Yeah, no, thank you for definitely diving in on that because it is such an important aspect of caregiving and you know definitely my mom who's really done the brunt of the work on the ground, she hears that and definitely takes that to heart what you just said there. So thank you for saying that. And yeah, you're right. It takes a team. It takes a team and we all have to care for ourselves. Put the oxygen mask on ourselves before we can put it on, or we're not going to be great. We're not going to be very effective caregivers, and it's not really fair. So that's great. And books like yours, they're just a great reinforcing tool to help us be the best caregivers we can. Because yeah, this is really the beginning of a phase where people have uh, they've crossed into this mindset of we can if we team up we can do this. We have tools. We can read this. We've got a course. We've got Dr. Heather Sandison. We've got Dr. Bredesen. and let's just take it step by step and team it out and implement these things. So, and we've seen tremendous results from it. So, it's just tremendous. Well, Dr. Heather Sandison, I know that you're really busy and you've got to get to your next call. So, last question I'm going to ask is, where can people find you and your team and your resources?
Yeah, Eddie, first, thank you for being such an incredible caregiver to your dad and helping and supporting your mom and your family. It's such an inspiration. And it's the reason I get out of bed in the morning is because people like you show up and are doing the hard, you are the boots on the ground doing the hard work. And I really, it makes me so hopeful and so inspired when we get to collaborate and have these conversations. And I actually am kind of regretting that I didn't ask you more questions because there's so much I learn when I get to team up with families like yours. So just thank you.
Yeah,
For anybody who's interested in learning more, drheathersandison.com is the best place to go. Sign up for my newsletter, stay abreast of the science and what's going on out there in the world of Alzheimer's and how much hope there is
yeah.
for those who are genetically at risk, starting to notice cognitive decline, and for caregivers out there.
Yeah. Awesome. Awesome. Well, Dr. Sandison, thank you so much for taking the time. Thank you for everything you're doing, everything you've been doing, everything we know that you're going to continue to do. You're very mission oriented, and we're excited for everything you're going to be achieving over the next several years. And my mom thanks you, my dad thanks you, and our listeners thank you. So thank you so much.
Thank you,
Talk
Eddie.
to you
Be
soon.
well. Take care. Bye bye.
Take care.